Hi, this is Dr. Abdul, Physiotherapist. Welcome to my channel. Human anatomy, directional terms. Learning anatomy is similar to learning a new language. There are thousands of anatomy terms that medical students need to master in a very short period of time. Anatomical directional terms are like directions on a compass of a map, like north, south, east, west, etc., which describe each region and counter to each other. Similarly, anatomical directional terms describe the locations of structures in relation to other structures or locations in the human body. This is particularly useful when studying anatomy, as it provides a common method of communication that helps to avoid confusion and medical errors when identifying these structures. This is also useful in describing the structures in dissection or surgery, or describing a pain or injury or movements. Let's see what are the anatomical terms are. Anterior or ventral describes the front or direction towards the front of the human body. As you can see in the diagram, this is anterior. Posterior or dorsal describes the back or direction towards the back of the body. So this is posterior. Superior or cranial describes the position above or higher than another part of the body proper. As you can see in the diagram, this is towards the cranial, called as superior. Inferior or caudal describes a position below or lower than another part of the body proper, near or towards the tailbone. Inferior. Medial describes the middle or direction towards the middle of the body. As you can see in the diagram, towards the middle of the body is called medial. Lateral describes the side or direction away from the middle of the body. Proximal describes a position in a limb that is nearer to the point of attachment or trunk of the body. There it is, proximal, towards the attachment, point of attachment to the trunk of the body. Distal describes a position in a limb that is farther from the point of attachment or the trunk of the body. This is distal, farther from the point of attachment or to the trunk of the body. Superficial describes a position closer to the surface of the body. So this is deep and this is superficial, closer to the surface of the body. Deep describes a position farther from the surface of the body. So this is a deep, this is superficial, and which is away or farther from the superficial is deep structures. Bilateral describes an involvement of both sides, that is right and left sides of the body part. Unilateral describes the involvement of only one side of the body part, that is either right or left side. Central describes the distance towards the center of the body. Peripheral describes the distance away from the center of the body. Modifiers. Let's see what are the modifiers. These modifiers are nothing but prefixes and suffixes which when attaches to the other anatomical terms, generally the root terms, will provide the intensity or location or direction to the structure or condition. So let's see the examples for the prefixes. Para means nearby. Hypo means below or under or low. Hyper, above or beyond or high. Supra, above or superficial. Infra, below or beneath. Inter, in between. Intra, within or inside. Brady, slow. Tacky, fast. Let's see the example of suffixes. Itis, inflammation. Osis, abnormal condition. Rhea, any discharge or pus seeping. Oma, tumor. Plasty, surgical repair. Tomy, incision. Ectomy, excision or removal. Sclerosis, hardening. Thanks for watching. Follow me at YouTube, Facebook, Instagram, and for any business related inquiry, contact me at dr.abdul.pt@gmail.com.